Hello there and welcome. My name is Travis Broadbeck, and I work at CARES of New York, Inc. I serve as the Operations Technology Specialist, which allows me to work in IT, but also work on special data analysis projects like this one. Thank you for joining us today, and welcome to the presentation. We'll be investigating signs of racial disparity in the community by analyzing data entered into the HMIS between 2018 and 2020. So let's go ahead and learn about the purpose of today's presentation. I want to set the expectations for today's presentation. Today is just the starting point, and our goal is very big and important. Our objective today is to come to an agreement with what the current status is of the community. Imagine this like the state of the COC address, where we come to a consensus on where we are so we can decide on where we're going. And after today's session, we want to start asking specific and pointed questions that will drive lasting change in our community. And by investigating these questions and finding these patterns in the data, then we can recommend new process improvements and dedicate resources to better serve the community. Before we advance into the executive summary, I want to cover the methodology of today's presentation. We're looking at 3 full calendar years of data entered in HMIS, and we removed clients without race data and clients less than 0 years of age or more than 109 years of age. Today we're exclusively looking at HMIS admissions. That is when someone shows up at a program, is entered in HMIS, and receives services. This data is not deduplicated because we're accounting for the total volume of admissions in the analysis, rather than the unique admissions. Here are the key points that we can take from this descriptive analysis. First and foremost, there is an overrepresentation of Black or African American clients in the homeless system, as recorded in HMIS. Whether you compare the population of HMIS admissions to the census population, or the poverty population recorded by the 2017 American Community Survey, you'll see that there is disparity in our admissions, an overrepresentation. Whether it's 27% of HMIS admissions are Black or African American compared to 7% of the total population is Black or African American, or 27% compared to 12% of the population that is in poverty are Black or African American. Next, we want to mention that emergency shelters, followed by coordinated entry projects, had the most admissions than any other HMIS project type in the continuum. And lastly, we see that COVID-19 did impact 2020's data with the lowest number of admissions that year, which has some other effects as well. This first visualization really ties into that first point from our executive summary. This is where we can see there is an overrepresentation in the homeless system of Black or African American clients. On the left side, you see our total admissions of all clients across 2018 to 2020. In the middle visualization, you'll see the census population demographics. And in the far right visualization, you'll see the American Community Survey 2017 poverty population rates. And either way you cut it, you can see that we have significantly more admissions in HMIS than we would do compared to the census population or the population that is in poverty. To add more context to the percentages previously provided, here are the counts of all the HMIS admissions between 2018 and 2020. You can see that besides the large majority of clients are white, we do have 2 other large groups, which are Black and African American clients, and our clients that identify as 2 or more races. In this visualization, now we actually break down the annual HMIS admissions per year. So we have 2018 on the left, 2019 in the middle, and 2020 on the right. Then the first thing that we notice is year over year from 2018, we are seeing a decline in admissions. And in all 3 years, we see that more white clients have been served by the system than Black or African Americans. But once again, we do see a pretty large grouping of both Black or African Americans and clients who identify with 2 or more races. But again, we do see this downward trend year over year. In this visualization, we see that almost 2/3 of our total admissions in HMIS are through emergency shelter programs, and that the other quarter or so is attributed to coordinated entry and the other project types. To add more context to the admissions, here we are looking at the HMIS annual admissions between 2018, 2019, and 2020 by project type. Things that we can notice here is our total admissions in emergency shelters declined dramatically from 2018 to 2020. And we saw a slight decrease in admissions from 2018 to 2020 in coordinated entry. Now, a couple other project types that we do see here is a slight increase in homeless prevention over the years, a slight increase in permit supportive housing over the years, and these are annual admissions. and a very dramatic spike in 2019 for rapid rehousing projects that went away in 2020. Now we're looking at our total emissions year over year just to get some perspective, and this is where we see that downward trend. So 2020 is very common where we saw fewer admissions in the HMIS, reason that being the eviction moratorium, there's other stimulus programs, lack of capacity since people had to social distance, so programs weren't able to have full occupancy, and a few other variables there. So we understand the impact of 2020, but the question is 2019, what was the cause of these declines in emissions? Were folks just better, or was the system already at capacity and unable to admit new folks? Now we're looking at homeless prevention admissions by race. We do see that this is less than 200 people across 3 years. So there isn't a large population that we're serving here. Just to note that in 2020, there was a big shift in the demographics being served compared to previous years, where we can see almost 3 times more white clients being served in homeless prevention programs than black clients, whereas it was closer to a 50-50 ratio in previous years. Now we're looking at emergency shelter admissions. This is the most frequently admitted program type. And what we see is the decrease in admissions of both white and black clients, and along with 2 or more races as well. And all of them have just kind of been going downward. So this might be, again, an indicator that the system was already at capacity before the pandemic hit, and the pandemic actually just furthered that issue. Looking at coordinated entry, we can see that year-over-year emissions also declined, but the decline in white clients was much more significant than the decline in black or African American clients. And when we look at total counts, and the level of clients admitted into coordinated entry of 2 or more races had remained relatively constant within that 22 to 30 range. And now we're looking at the rapid rehousing emissions. So what we can see in 2018 is that many more white clients are served by rapid rehousing projects than black or African American clients. In 2019, we see a huge spike in the number of white clients being served by rapid housing projects. And we also see the emergence of 2 or more race clients. So it's probably a family, if we had to take a guess, or multiple families, just because it all kind of popped up in 1 year. And then in 2020, we see a pretty large decrease from the previous year. Part of that could be the impacts of COVID, the eviction moratorium, a lot of stimulus money that went out there, but also could be an indicator that we filled up all our beds in 2019, and now in 2020 there were not many beds open at all. And our last visualization by project type will be permanent supportive housing. So we can see that this total population is 254 admissions across the 3 years. And the one that strikes me is the dramatic change in 2019. So we see that in 2018 there were 25 total admissions of clients who were black or African American in permanent supportive housing, and that went down by 16 in 2019. So what was that big shift? However, on the flip side, you do have an increase of 7 admissions of clients of 2 or more races into permanent supportive housing. So this could be just a data entry or a demographic issue, or it could be something altogether. So it's just something to look into as well. And something I also want to call out is just how many more white clients are being served by permanent supportive housing. But again, it's a small sample size, so it's hard to really distinguish if there's disparities or is just a representation of more clients in the system, therefore more likely to be in this project type. So now we're going to switch gears and look at 3 more visualizations to wrap up. The first we'll look at gender, then we'll look at veteran status, and then disabling condition. So first we're looking at gender. The main thing that really sticks out to me is how almost 50-50 the representation of the genders of clients by their race. So you can see that we have just slightly more black males than we have of black females, but we have almost identical males and females of 2 or more races. And then we do also have slightly more females who are white than white males. So all of this is just kind of noting that our demographics are pretty close to 50-50, and it just shows that we should have an equal offering of beds, essentially. So we should have family beds, single beds, male, female beds, just making sure that we keep that in mind, that we have an equal offering. So now we're looking at our annual admissions of veteran status by race. And between 2018 and 2020, we had 6,395 admissions. And all those admissions, we have fewer than 175 veterans. So this makes me think that the question may possibly not be asked, or there is a misunderstanding of clients when they're asked this question. For example, some clients might be hesitant to identify as a veteran if they were dishonorably discharged. Or if they served in the National Guard versus the United States Army, they might see that as slightly different. So this is really important to educate your staff and to follow up with other questions so clients understand what we're asking of them. So now we're going to look at disabling condition. Disabling condition is really important for clients because it could actually give them more opportunities to enter different project types or different programs. So having a documented disabling condition could make you prioritize more and more likely to be entered into a program. And the first that strikes me is how close we can see that almost 50-50 ratio between white clients with a disabling condition and white clients without a documented disabling condition in HMIS. But that pattern doesn't follow true when you look at our Black or African American clients, where 2/3 do not have a documented disabling condition and 1/3 does. And we can also see a similar pattern follow when you look at clients with two or more races. The reason we really want to dive into this is because we know from various forms of academic and community research that communities of color oftentimes have less access to quality health care. They oftentimes don't have their conditions documented, whether that's because of access to transportation, other systematic barriers, not having the proper insurance, unable to have an appointment, make an appointment because of work or childcare. I mean, there's so many variables that could be out there, but there are also other variables such as hesitancy to see a doctor because of concerns or past experiences. There are plenty of reasons and variables that can impact this. So this is why this is even more important, because there is a chance that we're under-recording this data and underrepresenting the number of clients who are Black or African American who have a disabling condition. So what could the community do about it? Well, they could partner with the county and have a mental health professional on call. So when a client presents with the symptoms at a program but doesn't have a documentation, we can go ahead and get them documented and get them entered into treatment services too, which is really important, is not only documenting this but also treating it. In addition, we could also partner with an organization to provide substance abuse treatment, since substance abuse could be considered a disabling condition according to HMIS. So these are all things that we want to make sure we include because these provide more opportunities to our clients. The data for today's presentation was collected from HMIS awards from the HUD Exchange and the United States Census Bureau. Thank you so much for watching today, and I look forward to your feedback.